All right. Hi.
What's going
Welcome.
on? Good to be here.
Good. Glad. Well, let's get started. Um, as people are coming in, welcome. Good evening, everyone. Thank you for joining us. My name is Elise Best, she, her pronouns. I am one of the board members for Black Girls Inc. Black Girls Link, and Black Girls Link is also known as BGL. It is a Black women-led network empowering Black women professionally and socially through sisterhood and activism. Thank you for joining us for this important conversation and discussion about COVID-19 and the COVID-19 vaccine. First, I want to give a big shout out to a Black woman scientist that exemplifies Black girl magic, Dr. Kizmikia Corbett, because she was at the forefront of COVID-19 vaccine development. Tonight, we're going to answer some frequently asked questions about the COVID vaccine, like what it is, how did it get approved, what was it like for us to get the vaccine? So please comment your questions in the comment section, and we'll try to get to them as we're able. Again, my name's Elise Bess. I am a hospital chaplain. I come to this healthcare conversation as a hospital chaplain. My job is spiritual and emotional support and accompaniment in the hospital to patients, families, and staff. And much of my job lately has been about the COVID-19 vaccine and advocating for patients and families and staff of color in our hospital around vaccine distribution and distrust of medical institutions. And I'm here with Dr. Charles Bell, he, him pronouns. He is currently in his final year of family medicine residency at Atrium Health in Charlotte, North Carolina, and recently accepted into a sports medicine fellowship. I'm going to pass it off to Dr. Bell to
What's going
introduce
on?
a little more.
What's going on? So, I'm originally from Chicago, born and raised. I completed my undergraduate studies at Howard University in DC, left, did some research back in Chicago, and then ended up coming back again to Howard University for my medical school studies as well. So I lived in DC for about 9 years prior to coming down to Charlotte, where I am for Atrium, am for Atrium Health. I've always dabbled a little bit in providing information in regards to healthcare. I would do it and I'll go away. But I thought it was more important for me to focus on residency. Let me get as much information as I can during this short time span so that I could be a resource to my community when I leave. And so I got accepted into fellowship. That was a big thing for me. I only have a semester left
Okay.
and residency. So I was like, it's time for me to start building this kind of base, start giving information out, the information that I know to help uplift my community.
Yeah. Well, I'm so grateful you took the time, because I think that there have been a lot of people talking about the vaccine, but it helps to see, one, people like us having a conversation about this vaccine. So having Black people do that, having Black people who are medical professionals like yourself, who work in healthcare, and who know some of the hesitancies that we have around getting care from medical institutions. And so that we can take that seriously and answer a few questions is really awesome. So thank you so much for being here tonight. Let's get into the questions. And like I said, you all please feel free to add questions in the comment section, and we'll hopefully get to all your questions and the ones that we have for us tonight. So first off, what is the COVID vaccine?
So the COVID vaccine, first, let's say, what is coronavirus, right? And we start this conversation. The reason it's called COVID-19 is because we found this virus, this type of coronavirus, in December 2019, right? So we named it -19. COVID-19 is a part of a family of hundreds of viruses that sit into this family of coronaviruses. COVID-19 is like the cousin that got the new outfit on, just went to Gucci. You know what I mean? It's just a different outfit. We've been studying these for a long time now. Through those studies, most recently, we had a big scare with SARS in 2002. We also had a big scare in 2014 with MERS. Through those studies of those outbreaks, we found this protein called the spike protein, right? And the reason that's so important is because it goes into the vaccine. Pretty much every vaccine that's out right now is targeting that spike protein. If you look at a virus, you see it as a circle. the spike is like a signal that comes off of that circle, and it's how it enters into our cells and starts to replicate. What we found is that if we can trick your body into thinking that you have this spike protein and creating it, your body can create an immune response to that as if you had the infection, and then be able to fight it off if you come in contact with the real virus in the real world. So that's how pretty much all the vaccines work, is making your body think that that spike protein is really there so that you can have an immune response that then protects you from any future occurrence or any interaction that you come into with coronavirus in the future.
Oh, wow. Thank you. That was so detailed. Next question. Which vaccines have been approved? And which ones? Yeah, you can answer that one first.
Okay. So 2 have been officially approved in America, Moderna and Pfizer.
Okay.
Those are both mRNA vaccines, which I can briefly. This third one that's coming on the board pretty soon here at the end of February into March would be Johnson & Johnson.
Okay.
You want me to? Okay.
And which vaccines should we take? Which one should we take?
So basically, I'll break down the vaccines. So
Okay.
mRNA is the new kid on the block, right?
Mm-hmm.
Pfizer and Moderna were studying mRNA vaccines for some time now. And it came to be that with this new virus, that it was the perfect environment for them to unleash this new wave of vaccination kind of program. Initially, they were trying to do cancer treatment with it and things of that nature. What mRNA does is it brings the message of the spike protein to your cell, and your cell then produces that protein off of that message. Those vaccines are 2-dose vaccines, Moderna and Pfizer. You have to get 1 dose to kind of prime your body, the second dose to say, okay, all right, we're ready now, to really up the ante. The Johnson & Johnson vaccine is different. It uses an adenovirus or another type of virus to introduce that spike protein to your body. Still safe, still presenting that spike protein, but that one is only 1 dose.
Mm-hmm.
So that's the big difference between those three vaccines.
Yeah. And so we have heard people talking about being scammed for vaccines. How do we know which one is the right one or where to go to even get the vaccine?
So that's why it's really important right now that everyone listening or whatever, you build a relationship with your primary care physician, because that's who should really be directing you. But also your state has a website. Mm-hmm. You need to go on Google and find out a toll-free phone number that you can call. I know some of our older populations, they're just not up to date on technology, so they may need to call somebody. But the CVS's, Walgreens, the Rite Aids, they're all doing it. I know here in Charlotte, they have these mass programs where they actually did it at the football stadiums and the NASCAR racetrack. Mm-hmm. So you should only be going to official places. If your cousin or some friend at work says that they have the vaccine, do not trust them.
Okay. All right. And like you said, some of our elders may not be so tech savvy. So look out for the elders in your community. If that's your family, if that's your neighbor, call on their behalf if you can be helpful, and make sure you're connecting them to the right resources so they don't get scammed. Look out for your people. So how did the vaccine get developed so quickly?
I think the best way to look at this is like, it's almost like when you look at what's the name of those fundraising things that they do with, if something happens to someone, they can raise a lot of money, like GoFundMe's, and somebody may need to raise $20,000 to get something done. That GoFundMe can really get that money within a couple hours. Mm-hmm. And that's what we're looking at with the vaccines. The technology was there. They were already playing with it, but this coronavirus affected the entire world. So money came from Europe, from America, from Asia. Everybody poured money into trying to identify what's the best way to prevent infection from this thing. Mm-hmm. So when you get all of these masterminds of vaccines and viruses all together on one collective accord, you're going to get these kind of profound effects like this, like producing a vaccine within 1 year is the best way to look at it.
So is that what an emergency use authorization is, or what is that? And how's that different from the usual vaccine approval process?
So when you look at vaccines, they could typically take like 10 to 12 years to create, right? I think one of the fastest ones was like 4 years. It was like mumps or something like that. This one only took 1 year. And it was because of the emergency use authorization. The technology was there, the money was there. Generally, the FDA wants to get data over time before they actually said, okay, you can use that medication, you can use that device, or you can use that vaccine. In this case, we needed stuff so quickly that they ramped it up and put all their focus on the information that was coming specifically for coronavirus. So it sped up things, and then they allowed it to get emergency use, so that we can be up to date on what treatments are working and what vaccines are actually working. And the ones that have been approved, the treatments that we use in the hospital, those are all been approved as effective options for treating coronavirus.
Okay. So who's approving the vaccine? We're talking about the approvals, and yeah, who's approving that? Who's endorsing the vaccine?
Well, the World Health Organization is approving it. Dr. Fauci and the CDC is approving it. Pretty much every major health organization worldwide is approving the vaccines. The vaccines that we're using.
Yeah.
So you have all hands on deck. All the big boys are in play on this one and are involved on making decisions on which ones that we are using.
So it's safe to assume that the vaccine is safe then?
All data that's coming to us now says this vaccine is extremely safe.
Okay.
There's not one vaccine on the market that is unsafe.
Okay. Thank you. If I get the vaccine, do I still need to take other safety precautions? Can I throw out my mask? Do I have to double mask?
So the good thing about the vaccines is that it is providing you the Moderna and Pfizer 95% protection from getting it and severe moderate infection. The Johnson & Johnson also from moderate severe infection going to the hospital. That's what the vaccine is protecting you from. What we don't know for 100% fact is that it prevents you being an asymptomatic carrier of it and then giving it to other people.
Mm-hmm.
So that's why even if you get the vaccine, you're protected, but we don't know if you can carry the virus without any effects to yourself to other people that haven't gotten the vaccine yet. So you still got to wear the mask. You still should social distance as much as you can. And you still need to be washing your hands as much as you can as well. All those things we learned over the last year, we should be carrying into the future regardless. So
yes. Okay. So still wearing a mask, still washing our hands to the length of a happy birthday song, social distancing. Now don't be gathering a bunch of people inside and traveling all over the world. Just be safe, be careful, be cautious. Because we're still in the beginning stages, right, of figuring out.
Still the beginning. We don't know too much about. I mean, we know something about the virus, but we don't know enough. We don't know enough. We don't know enough about kind of everything that's going on right now. So it's just stay as safe as possible. Yeah. Stay as safe as you can.
And then, why should I get the vaccine? And why did you get the vaccine? You got it, right?
Yeah, I got it. I got the Pfizer vaccine actually, so I completed both doses. I got it because I work in the hospital. I'm on the floors with COVID patients. I see patients in clinic that could or could not have COVID all the time. So I'm super high risk, right? And then when I found out that we would have first access to it, I didn't want to pass that up. I felt it as a privilege to do so. After I did my research and looked and saw that it was safe, I wanted to make sure that I was taking advantage of the opportunity that was given to me. And even after the vaccine, I'm still high risk. I'm still around these patients, so I need to be as protected as I can possibly be. So that's why I got it.
Yeah.
Did you get it?
I did get it. I also got the Pfizer vaccine.
Okay.
How did you feel going into? So you said you felt like it was a privilege, like you should get it done. But were there any anxieties going into it?
So I'm pretty much like everybody else out there, right? I grew up in the Illuminati era. I grew up in researching all these conspiracy theories. So immediately I thought, oh, here we go again. Here goes something else. They're going to try to track us and all these things. And then I did my research. I was nervous about a couple weeks out as I got more and more research. I talked to my colleagues about it. I talked to my family about it. I felt more comfortable going in. And the atmosphere there is just so friendly, so inviting. You feel like you're in a safe place. So I felt normal. by the time I actually got there to get it.
Okay. Yeah. Well, I hope that we'll talk about your experience of the vaccine next, because I got the Pfizer vaccine. I have completed both doses. It's been weeks since I got the second dose. But I was nervous about getting the vaccine. So when we got our email about getting the vaccine from our hospital, I was like, I don't know if I want to get it. Not because I don't believe that the vaccine is necessary, but because what we'll get into in a little bit later is the distrust of medical institutions because of medical racism. And so not really distrust of the vaccine itself, but what kind of care am I getting from the people who are administering the vaccine, and how will they care for me if I do have a reaction to the vaccine and I'm admitted to the hospital? So I just want to name that it makes sense to be anxious about the vaccine. We have rights. We have a right to be concerned and worried for ourselves, especially because the vaccine is new and the virus is still new. But I did get it. And I'm all right. I'm here weeks later.
Exactly.
So can you talk about, yes. Can you talk about your experience of the vaccine? What was the first dose like? What was the second dose like? Any reactions?
So I get in healthcare, we get the flu vaccine every year. You get a little sticker on your ID badge to show that you've gotten it.
Mm-hmm.
First dose of the Pfizer felt a little bit less. It felt like it was less material than what they give you with the flu vaccine because it's just one shot.
Mm-hmm.
The next day, my arm was sore, but that was it. That kind of cleared up. I remember being on service and like just moving my arm around like, dang, I'm pretty sore here. And then that cleared up by the end of that day. So that was about just 24 hours. When I got the second, but one of my colleagues though, he had chills.
Mm-hmm.
He had body aches for about 24 hours after the first dose. So he was going through it a little bit. But within 24 hours, like I said, I'm not just throwing that number out there. He was back to normal. He felt like he was back to himself. After the second vaccine, I also had arm soreness again, but then I was more fatigued. I was definitely the next day. I was like, you know what? I need a nap. Or when I got home, I went to sleep for about 3 or 4 hours. The next day, I felt back to normal though. I didn't have chills, fevers. I didn't have any of those other aspects of it. So it was a smooth process. It felt like any other vaccine that I've gotten.
Okay. See, I'm glad we're talking about this.
Right.
We had different experiences of this vaccine. So they say that be prepared when you get the vaccine because it'll feel like if you have reactions to the flu shot, you might feel a little sick. I never have responses to the flu shot. So I was like, I'm going to be fine. So I got my first vaccine on Christmas Eve, the first dose of the Pfizer vaccine, and was incredibly sore in the arm, like right away. And I never feel really sore, but it was like, don't touch me. Don't touch this arm. And it was like that for about 4 days. So I was incredibly sore for 4 days. Like I was like, this is hard, put it on a sweatshirt or a coat. Painful, didn't sleep on it, and was tired. But then was fine after 4 days. I mean, no other reactions but a sore arm for 4 days. When I got the second dose, whenever the appropriate amount of time was later, I don't remember what the in-between dates are, but whenever I got the second dose, is it 21 days?
21 days. 21
okay.
days, yeah.
I was like, did I make up this number? So 21 days later, I got the second dose and a little sore in the arm. And I felt all right. I live an hour away from where I work, so I drove home an hour. So it was okay to do that. Right. But it was very sleepy. Like normally I could stay up for a couple hours when I get home, but I was knocked out. And woke up the next morning, showed up to work, felt fine. They had said that the second dose might take you out with the Pfizer. And I was like, obviously, I have a stronger immune system than other people because I'm showing up to work. I felt fine getting to work. Once I got there, like 3 hours in, I was like, never mind. I got to go home. Again, I drove an hour back home and went immediately to sleep. Like, didn't change clothes, just knocked out on the bed. And had like a fever and chills, a stomach. I felt nausea. My partner was just trying to like get me to drink fluids and eat, and I couldn't eat. But I had a lot of fluids. And basically like tried to sleep the entire day until 9:30. So I got my vaccine my second dose on a Thursday night, and didn't feel anything Thursday evening when I was sleeping. Friday woke up and went to work, but by like 10 a.m. on Friday, I was like, gotta go home. And I slept from whenever I got home, so probably noon to 9:30, and then like
Wow.
that, I woke up and was like ready to hang out, and I was like, let's be up. And I still wasn't feeling great, but I could sit up. So I
Okay.
was so done that I was like in the bed, don't talk to me. I can't read text messages, don't nothing. But by 9:30 was awake enough to do stuff. And then Saturday, I felt a little better. I worked out a little bit. And I thought I was doing okay. And then Sunday came and I was like, oh no, I'm feeling better Sunday. And by Monday, I was like, I'm back to normal. I can go to
Wow.
work.
Okay.
I'm all set. So I just want everyone to get an idea of the range of how you could feel after you get this vaccine. You could feel absolutely nothing. I have coworkers who were like, I didn't feel a thing. And some were like, had what I had, but also had sore, like achy body parts. And so it's important for you all to get an idea of that, because if that hadn't gotten a heads up, I would have been like, I'm dying. I need to go to the hospital. But I was actually doing okay. And so I want everyone to have a heads up that you could feel just really unwell. But that's the range that we have to share with you all.
Yeah, I'm glad you shared that, because what I felt was nothing compared to what you felt. And you went through the pretty much the worst of what a vaccine could do, and you got back to normal.
Mm-hmm.
What I want people to know is that when you have side effects to a vaccine, that's literally your body reacting to it the appropriate way.
Yeah.
And it's building those antibodies. And with those antibodies, you get that mild inflammatory response to actually get the results that you want and for your body to be able to fight it in the future. So side effects are completely normal. You had the most extreme case ever.
And it's funny, a good amount of my department are like the nurses that I talked to when I came back to work, the chaplains I work with, everyone had side effects. So like it feels very rare to meet people who were like, I had nothing. There's one person at my job that was like, I'm fine. I came back to work and I'm okay. And so that's another thing to keep in mind, is what I shared about my experience and what we were advised at work is to, when you get the vaccine, take it close to a day that you don't have to come to work, especially for those people who don't have the extra time off of work, who need to be cared for at home or have just think about when you're going to take this vaccine. Think about, when do I have time to feel a little sick? And do I have time off for that? Because that's what our hospital said. They said, because we're healthcare professionals and we can't have a bunch of nurses and doctors and whoever taking time off, please take it close to your days off so you can be home on a weekend when you weren't planning to work. I will also say that my institution provided us 48 hours of time off. So if I needed to go home on Friday because I wasn't feeling well, my institution was like, that's fine. You have 48 hours of sick leave just for the vaccine. So I don't have to use my paid time off, my earned time. That was all set. And so find out if that's something your institution is offering. And if they're not, now you know that other institutions are doing that. Advocate for that for your institution and for your colleagues.
I completely agree with everything you just said. Yep.
Yeah. So let's talk about why people aren't getting the vaccine. Or any other thoughts on that before we move on?
No, reach out to your organization and see if they can give you a day off after the vaccine, because you may or may not experience side effects. So I agree with that. Yeah.
Yeah. Okay, so why do you think people aren't getting the vaccine? And this is Black Girls Link. So we're expecting a lot of Black people to be coming on to this video, either watching it later or being with us live. And we're two Black people talking about the vaccine and healthcare, because we know that we've been disproportionately affected by medical racism. So can you talk a little bit about why people are hesitant?
I think it pours into multiple. I think it's like two realms. One is, I think Black people in general, we love information. We love getting information. That's why we're on social media all the time. That's why we watch the nighttime news, and we love it. But it's how we take in that information, absorb it, and then utilize it, right? And I think a lot of us don't have either appropriate relationships with our primary care physicians or other medical professionals that can help break down some of that all this kind of water hose information we're getting. So we're kind of confused, like, well, I don't know what to do. And then you go into this other box of, we have every reason not to trust what the government has to say to us, right? We have every reason not to trust what healthcare has to say to us. Since slavery to now, we've literally dealt with structural racism in regards to healthcare, wealth management, access to loans, housing discrimination, police discrimination, incarceration, right? We've dealt with every level of discrimination you can ever experience as a race. So now all of a sudden they come out and say, you know what, we're gonna get a vaccine to black people first. And it was literally the worst thing they could have done, because it's like you didn't read the room. The room would have told you, if you went into the room would have said, look, bro, don't do that one. Like, if you're gonna want to spot test, put centers in our community, give out more information, break down, talk to real people about what the vaccine does. But they went out with this broad marketing scheme that just did not work for them. So it really
They
broke
didn't
down
talk
the
to
trust.
us. They didn't talk to us.
It broke down the trust even more. So so now we're digging ourselves back up out of all of that, which is not an easy fix because it cuts so deep. So I think it's just a overwhelmingly reason to distrust the healthcare system, but also we're getting so much information. Who do we turn to? Who do we go to help break down the information for us?
Mm-hmm. Yeah.
What do you
I'm with you. All of that. I'm like, you didn't talk to our people. One, medical racism, and you brought up since the first Africans have been documented as being brought to the United States, so 1619, the experiments on Black people for the benefit of white people receiving healthcare in the United States and abroad, and the experiments here and abroad on Black and brown people are reasons that we're distrustful. And I want to name that for the people who are watching us now and who are going to watch this later, that we are, just like Dr. Bell said, we have a right to be distrustful of the institution, of the medical institution, because of a history, a gross and long and very current history of medical racism against us. And so if anyone's ever questioning you of that, please feel confident in saying, no, I have a right to be distrustful, and I have a right to ask all the questions that I need to make sure I feel safe and secure enough to get care, wherever it is you're getting care. And books that I really appreciate and authors that I appreciate for their work of documenting this are Dorothy Roberts' Killing the Black Body, and Harriet Washington, author of Medical Apartheid, who document how medical racism has just succeeded here in this country. So those are reasons that people are distrustful. And a lot of people name the Tuskegee experiments or Henrietta Lacks. And there are so many more that go unnamed. Go ahead, Dr. Bell.
I think even so we could break down some of these. When you look at during slavery, the vaccines that became available, the slave masters would give it to the slaves first. Like, oh, let's monitor, let's see what goes on here. Oh, they alive. Okay, all right, give it to. So we were test subjects there, right? And then you hear about a guy named Dr. Sims, who used Black women's bodies to become the founder or the father of U.S. gynecology, right? He would use Black slave bodies because he needed them to perform these surgeries on them to practice his craft, and then dispose of them if things went array or whatever. So women have a deep history of not being able to trust the healthcare system. Yeah. And then you look at when you're in medical school, you have to use cadavers, right? You cut into cadavers, you study the muscles, the nerves, the vessels, to actually learn more and more about what you'll see in the real world.
You can see my face responding to
that. I know. That was actually one of my favorite parts of medical school. But of course, they dug up slave bodies and presented them for cadaver use all over the country. So when you look at medical experimentation, it was done on Black bodies, right? And then you move into these sterilization programs that started in 1932, which is great in that book that you mentioned, Killing the Black Body. Went from 1932 to the 1970s and 80s. They sterilized around 60,000 women. They targeted Native American, Puerto Rican, Black women during these programs. They found out last year that it was still going on in California up into 2010. And it's also a whistleblower that said it may have been going on at these at the facilities that they were keeping the people that were trying to cross the border, that they were giving them hysterectomies against their will. So,
right, this summer.
Yep, this summer. So it's a deep history of medical distrust that is targeted Black people specifically. And we don't even have to get into Tuskegee experiment because we all know so much about that and how it kind of ravaged those Black men's lives throughout like a 40-year period.
Yeah. Yes. Thank you so much for naming all of that, because what as a chaplain, I said that I've been doing a lot of advocacy for patients and families and staff at our hospital, because a lot of people have been dismissive of Black people's valid fears and anxieties about getting medical care, and thinking, you're just making up stories, or these are conspiracy theories. And I want to be clear, these are not conspiracy theories. Conspiracy theories are that somehow our election wasn't valid this past year. But these experiences are based on fact and are documented. And whether they were documented or not, we have those stories in our memory. We have oral history of our parents saying, nah, the doctor doesn't listen to me when I go. And we know that when people go to medical institutions, that Black people are listened to less, that their pain is treated differently, that they are offered different treatments. And so I just want to name that, and also encourage people to continue to advocate for yourself. Yes. So when I got my vaccine, I went into the person who administered it, yep. Asked me how I felt about needles. And I was like, I don't really like them. I don't, but just do it. I'm gonna look away. And he was like, did that hurt? And I was like, it did hurt. And he said, no, it didn't hurt. It's fine. And I was like, no, it did hurt. And I need you to know that, because something we didn't name is that also when you get the vaccine, you're monitored for about 15 to 20 minutes after you get the vaccine to make sure that there are no reactions to it, and so that you're safe enough to go home. And if you do feel unsafe when you get home or whatever, please contact your physician, your nurse practitioner, an ambulance. But anyway, they're supposed to monitor you. So I was like, I need you to know that if this hurt, you need to take me seriously, so that you know that while you're monitoring for these 15 minutes, so that I can trust you for these next 15 to 20 minutes, that you're paying attention to how my body's reacting. But that administrator denied that pain. And I had to check him real quick and say, that you're telling me, a Black woman, given this history, that I don't feel, that I'm not feeling the pain that I'm feeling, and how unacceptable that is. Mm-hmm. Please advocate for yourself at every stage of this. So that you can feel like you can trust the people who are supposed to be taking care of you.
And even the physicians, the nurses, the medical assistants, if you see something weird happening around you, you better step up and say something. It doesn't necessarily have to be you have to stop unsafe behavior immediately. But if you just see something that's a little bit off, you may need to check them on the back end. I've had to do that, and it can be uncomfortable, but it's needed for growth within the healthcare system.
Yes.
But that's also why it's important. You have to establish a relationship with somebody you trust. I think a good way to put it is, especially with Black Girls Link, if you go to a hairstylist and they mess up your hair, they do the braids wrong, or they way too tight, your forehead hurts or whatever, you're not going back to the hairstylist again. So if you go to a primary care physician and they're weird when you're in the room with them, or you don't trust them, you have to go pick somebody else that you trust, because health is not something that we can sit on the sidelines for. It's extremely important. You have to be proactive in regards to health, right? So be an advocate, seek out people that you trust, talk to others, share information on, oh, that doctor is good, or that emergency physician did not treat me well, so that we know how to avoid these people in the future.
Put your people on. When you have good experiences and when you have bad experiences, let your people know, and also advocate for yourself through reporting those concerns if you feel safe enough to report that to the institution that you're getting care for. So there are ways for you to advocate for yourself anonymously and contact patient relations at a clinic or at a hospital that you're going to make sure that the incidents that make you feel unsafe are recorded. Because if they're not recorded, an institution will do nothing about that. And when you're advocating for yourself, you're advocating for everyone else in your community. Because when I speak up just by myself, people are like, I don't know that this is really happening, Elaine. But if I report it enough times and enough other people report it, then people respond to that. Yep. So we're still saying the vaccine is safe, that it's approved, and at the same time, there are still things to be concerned about. Please advocate for yourself. If you're feeling some reactions, report that to whoever you're in the care of, your physician, the hospital, whoever gave you the vaccine.
Yep.
Yeah. Any other thoughts there?
100.
Okay. The other thing that I want to name, and you can speak to this too, Dr. Bell, is we're naming these experiences of medical racism to also make the distinction between Black people who are being called anti-vaxxers because they're anxious about the vaccine. So anti-vaxxers are people, and you can speak on this too, who are like, no, the vaccine isn't real and COVID's not real and we don't need it. We should be giving it to our people. That is not what we're talking about. We're talking about people who, most of us Black people want the vaccine. We want to be safe. We want to be taken care of. We're also concerned about the care that we're going to get when we're coming into the institution to get the vaccine administered in the first place, and how we'll be cared for if we have reactions that require us to be admitted to the hospital. But there's a difference between being an anti-vaxxer, people who don't believe in this vaccine, who don't believe in science, who don't think, I don't know. And then there's people who are rightfully anxious and want to make sure that they have all the information that they need. Because you're right, Dr. Bell, about the water hose of information. Like, there's so much information coming at us, which is why we want you all to please write questions in the chat so we can take the time to answer the ones that are coming up for you.
Yeah, I think it's multifaceted. I think that it's people that are afraid of the vaccine because of the side effects. So that's why I'm glad we shared these two different sides of it, is because you had more extreme and you're here on this Instagram video with me right now and doing fine.
I'm alive.
I had very mild symptoms and I'm fine. That's the range that you should expect after the vaccine. But the benefits from it, 95% protection from going to the hospital, protection from dying from COVID-19 is almost 100% wiped out with the vaccine. So the risk to benefit ratio is extremely high.
Yes.
Some of the conspiracy theories, I think some people thought, oh, you know what? This is going to attach to my DNA and follow me around. And then you have to think to yourself, one, it's an mRNA, so it doesn't even go to the DNA. But two, you have a cell phone. They know where you're at. They can listen in on your conversation. They don't need to inject you with anything. You have a phone on you right now that they know exactly where you're at all times. So I think that's another one that we need to kind of move to the wayside. And then a third box here is that the same Pfizer vaccine that me and you got is the same one that Becky out in the suburbs is getting. Sorry to use their name. And Dr. Fauci got the Moderna vaccine. My grandma just got the Moderna vaccine. She got the same one. You know, they're not adding in a little sauce and adding in something else in certain places to get over. Like, that's not what they're doing, because as soon as they did that and it was an uptick in deaths or uptick in more, that vaccine would then have to go back and then have to go through another regulatory cycle. So they're making this as safe as possible for us. They want all of us to get it. It's up to us to be proactive in doing and looking out, getting information, and finding somebody you feel comfortable with talking about it.
Mm-hmm. Yeah. Please talk about this. Please talk about this with your family, your friends. Share this video with people. Okay, so next question, because this is very interesting. So and at least in my institution where I'm working, we found that people of color, Black and Latinx people are the lowest rated people for getting the vaccine. So we're the smallest percentage who have gotten the vaccine. And then within that number, it's actually women, female-bodied people who are able to have children, are the people who are not getting the vaccine. So male-bodied people, if there are Black or Latinx, they're getting it. If they're getting it, then they're male. But the female population is worried. And what I keep hearing from people is, what does this do to my fertility, my chances of having children? So can you talk about what we do know about the vaccine and how it impacts fertility?
Well, what we do know about vaccines in general is that we give pregnant women vaccines. We give them a pertussis vaccine, which protects them and the baby from giving that whooping cough, which babies can have a really bad respiratory reaction to that, especially early on after their delivery. We also give the dad that as well. We give moms influenza vaccines. We've done that for years on years now, and they do well with it. Mm-hmm. There's nothing to say that this vaccine should be any different.
Okay.
Now, the problem that lies here, and I think women are may even be more keen to data, is that pregnant women were excluded from the vaccine trials. So if you were pregnant, you were not technically included in the vaccine trials. But what came out was that there were about 10,000 women that were pregnant that got the vaccine, Pfizer Moderna vaccine, and completely safe. What we don't know is if those antibodies that protect mom also protect baby, or go into the fetus and start building immune for the baby. And we don't know, and we do know that it's safe to breastfeed with the vaccine, but we don't know if the antibodies cross over through your milk and protect baby through the milk also. So we know it's safe to get it during pregnancy so far, and we know it's safe to actually breastfeed after getting the vaccine as well.
Okay.
And there's no reason to expect that it should stop you from being fertile or stop you from having a baby in the future.
All right, then. I think you also answered the next question, which was, will the vaccine have long-term effects on babies that are in utero right now? And
it doesn't appear to. The biggest hope is that when you get the flu vaccine and these other vaccines, you get that protection passes on a baby while they're still in your womb. Mm-hmm. They're still doing research now to make sure that actually happens, okay. Or if it happens or it doesn't happen at all. So that's pretty much the research that's ongoing now. But for all full intent, it seems extremely safe. I think for women in particular, I think it's important to look at the risk and benefit ratio, right? Mm-hmm. If you're living at home by yourself, it's just you and baby father, you're not working. You don't have a lot of random people at your house that could be out going to parties, traveling, and doing all those things, bringing coronavirus to you, and you've avoided coronavirus thus far, maybe you can sit back and say, you know what, let me wait things out. Mm-hmm. But if you work in healthcare, you're still working in general, you're working at the fast food restaurant, grocery store, or out in public in general, you're around people that's in and out of your house. You live amongst a lot of other people that aren't vaccinated, that aren't really following the rules as they should. You're at extremely high risk to get mm-hmm. coronavirus. And what research does show is that pregnant moms that get coronavirus do worse than women without pregnancy.
I'm glad that you said that, because that's something I want to name for people here, is that my understanding is that the vaccine, you may have some side effects like I did. They don't compare to getting COVID. And when I told y'all about my side effects, it was terrible. It was a terrible day. I didn't like it. And I kept thinking, thank God I do not have COVID, because my body was going through it that day. So just keep that in mind, that what you're choosing is a day or so, or a couple days of discomfort, hopefully just a couple days, over getting COVID, which is worse.
Yeah, 100% worse.
Yeah.
I can speak on that later. Yeah, I'll touch on that later. Yeah.
Please do. We have like 14 minutes left. We have a few more questions, look, y'all, if you have questions, please add them to the chat. I haven't seen any yet. So go ahead and speak to that, Dr. Bell.
Maybe we're knocking everything out for him.
I hope so.
But I think from the research we have now regarding the vaccine, it's extremely safe, whether you're pregnant, whether you're elderly, whether you're young. They're doing research now on kids, on the adolescent population. Mm-hmm. What we don't know is what coronavirus is going to do to your body 5 years from now, 3 years from now, 10 years from now. And what research is saying is that it can affect your heart, cause inflammation of the heart, that as a sports medicine physician, I have to now rule out kids for heart disease. And then we have to recheck them each year if they have coronavirus to make sure that they haven't had heart damage, right? People that may have been prone to develop dementia may be developing it sooner after the coronavirus infection. There's also this piece called long haul COVID syndrome, right? I'm writing notes. I know patients that have got coronavirus infection in January, mild, moderate, they stayed at home. I'm still writing notes for them today to not return to work because they're still tired. Their loss in taste or smell is just now coming back. They're having occasional headaches, and that's what is a part of this long haul syndrome or post-COVID syndrome that we're finding out. There's more risk in planning willy-nilly. If I get it, I should be fine, than it is to getting a vaccine, being proactive about your health, and preventing that infection from the beginning.
Yeah. Thank you so much for saying that, because yes, people have gotten COVID and gotten over it, have recovered from it, and are still not back to normal. They're saying my breathing doesn't feel the same. I'm I'm an athlete, like I am a D1 college athlete, and I still don't feel. I know my body, and I'm still not back to
Exactly.
100% months later after having COVID. Months and months later,
Yeah.
like they had it in March and are still like, I'm not feeling it. So
Exactly.
please be careful. Please be cautious. Make the best decision for you, your family, and your body. Ask questions. Advocate for yourself. We hope that we're answering a number of questions for people while we're here. Um, will the vaccine protect me from, I think you've already mentioned this, will the vaccine protect me from getting COVID or just make me less likely to become very sick?
So right now we're thinking, I know with the Pfizer Moderna, it works so well against that spike protein that's the same protein that it utilizes to get into your cells in your body and start to replicate, that you may not even get the infection. You may
Mm-hmm.
not get the infection, but we don't know for sure. We don't know 100%. It's still that 5% chance that you can still get it. With these new variants coming out, I think we should be concerned about the variants, but all of the vaccines have shown efficacy, effectiveness against preventing hospitalization and death despite the variant, right? So that's what makes it even more important to get this vaccine. So we don't know if it prevents infection yet, and we're still doing research on that.
Okay. How long will the vaccine protection last? Does it expire?
Well, previous vaccines in these categories, especially with coronavirus, it gives you a robust response, it seems like. Um, right now, we're only, I think, Pfizer and Moderna has only been active since about November, whatever. So we're looking at like 4 months. We know for a fact 4 to 5 months is still protecting, and they're going to follow people for years on years on years to see how long it protects. So we don't know for a fact how long it lasts yet.
So do we know yet whether we'll take the vaccine every year, like we take the flu shot every year?
So I think this is a good point to kind of mention this, is that coronavirus does not look like it's going away, right? It's likely going to become our generation's influenza virus. I mean, that's all intents and purposes is what it's looking like. That it's
Okay.
going to become our generation's influenza virus. And that means that it took about the Spanish flu, which is kind of the 1918, which reminds me of the COVID pandemic that we're going through now. We've experienced that flu so many times now that if we come in contact with the flu, even without the vaccine, our body's like, okay, I've seen this before. I've seen this before. Coronavirus is still so new to us
Mm-hmm.
that these variants still pose a risk in the meantime of causing severe infection if we come in contact with it again. So I think I forgot. I forgot the initial question actually.
Will we take the vaccine every year, like we do the flu shot?
Right. So with the variants, if there does become another variant that is more dangerous or is more infectious, or you can still get it despite having a vaccine or whatever, I think they will introduce booster shots to the
Okay.
vaccine.
Okay. And we already talked about side effects that we had, but can you just name the side effects that we might expect if you're getting the vaccine?
I think you can expect headache, fever, chills, body aches, nausea,
Mm.
um, and arm soreness wherever you get the vaccine shot. Those are pretty much the major side effects that you should expect to feel.
Yes. Yep. Okay. So those are all the things that I felt, y'all.
You felt
Just
everything.
plan to chill out at home. Like you might not have any side effects, but you might have plenty, and you might have them all at once. Just plan to not do anything for at least a day or two. Have someone that can take care of you, get you something to drink or eat. Talk to your neighbor. We are a community that cares for each other, so talk to your neighbors, meet them, be like, "Can you check on me? I'm getting this vaccine tomorrow." Um,
And there's nothing wrong with
and,
that.
right. Um, can I where can I get the COVID vaccine from? So how do they find out where can I get it?
Yeah, we talked about that in the beginning. It's go on Google. If you're older, ask your grandkids, ask your nieces, like ask them to go on Google, type in it should be a toll-free number you can call.
Mm-hmm.
Or use the website in your
Yeah.
county to make sure that you're eligible to get it, and they'll tell you the locations to go get it from. but most of the pharmacies are doing it. I know here in Charlotte, they were doing some mass vaccination events as well. I'm actually going to one tomorrow for a Black community to make sure they have access to it. So
Yeah.
it's be proactive, go on Google, get on those websites, call those numbers to figure out where you can get it from.
Okay. And can we get COVID from the vaccine?
So I actually made a video on this, and no coronavirus was cut up and put into these vaccines.
Okay, that's right.
It's all a trick. It's science playing a trick on your body to make it think that spike protein, which is actually on the real coronavirus, is in your body. Mm-hmm. So your body can respond to that. So it is impossible to get coronavirus from a vaccine because no coronavirus is in the vaccine.
Thank you for naming that, because I think people are saying like, oh, because you have side effects from the vaccine, you got COVID.
No,
you didn't get COVID. Your body is just being tricked to make sure that it's ready in case COVID does come its way. Your body can respond as it needs to protect you. So what I was told when I was feeling all my things out, they were like, your body is working, your body is working, your body is working to protect you from the vaccine. Appreciate it, take care of it, stay safe, everyone.
You want to feel something. You want to feel a little something like, okay, I know it's working, you know? You want to feel a little something. So
yeah. Is it safe to take pain relievers before the vaccine? Can I take them if I develop side effects from the vaccine?
I think this is a great question, right? And when I saw that you wanted to ask, I was like, where'd you even find this from, you know? Because I had a patient come in clinic and just throw that question at me. I'm like, ugh. So I actually did a little research on it. Nothing is set in stone on that yet. But what the thought is that if you take some ibuprofen or some Aleve, you'll be decreasing the inflammatory response that your body needs to have to the vaccine. I don't know. Okay. If you're having really bad arthritis, if you're having really bad back pain, or whatever you're taking an NSAID for, take it. If you can avoid taking it before the vaccine, fine. But if you need it afterwards, you should definitely be okay doing it after the vaccine. Okay. So if you can avoid it. But it's nothing set in stone. It should not really affect your body's response. Okay.
Thank you so much. These were all our questions. I didn't see any questions from the people attending. So hopefully we have answered all your questions. Please advocate for yourself. Please ask more questions about the vaccine. We hope this has been helpful to you. Share this video. Be supportive of the elders, of the people who aren't as tech savvy and joining here. We're here, but we have people in our community that we need to be looking out for. So please check in on them, share this information with them. The one thing that I want to name, and then I want to hand this off to you, Dr. Bell, to have any final words. I know that we had this conversation in English, and so a lot of English speakers are probably watching this, but we know that our friends, our family, our community may not be English speakers at all, or not be masters of the English language. And so we want to make sure that when your family, your friends, your community are going to a clinic to get care, that you're with them, supporting them, asking for an interpreter if they're available at your hospital. They should have them. Making sure your paperwork is in the language that your loved one needs when they're going to the hospital or the clinic to find out about the vaccine. You can ask for all of that. And I think that's been a big barrier for people from the African diaspora, because we speak many languages, but we are so English centered that we don't always think about the people that we're caring for. So you can advocate for yourself and for your community by saying, my person needs this language, or we need an interpreter, or I'm going to go with this person and make sure that they have all their questions answered when they go to the institution. Because sometimes people in healthcare fields are either super busy or don't think to ask to make sure that everyone feels safe and secure enough to get the care that they need. So I'm going to pass off to you, Dr. Bell. Any last words?
I think it's a question there. Did you want to answer that first, or do you want to do them at the end?
Is the Johnson & Johnson vaccine expected to be as effective as the Pfizer vaccine?
So from the information we have now, the Pfizer and Moderna vaccines are about 95% protective of getting infection and moderate to severe symptoms. The Johnson & Johnson is a one-shot vaccine, and what it is showing so far is it's 72% effective in preventing infection, but it's 100% effective in hospitalization and death. right? The most important thing that put the biggest strain on our healthcare system was that everybody was going to the hospital, everybody was needing oxygen, everybody was going to the ICU. That vaccine is as effective as any other Pfizer, Moderna, whatever one you want to name, at preventing moderate to severe hospitalization, death, and those are the most important factors that we care about.
Mm-hmm. And there's one more question: are chills one of the side effects after getting the vaccine?
It is. It's a common side effect, actually.
I had them.
No, you had everything.
I survived.
You had everything.
Well, we have 2 minutes. 2 minutes. Any last words from you?
Yeah. So what I want to say is that the conversation, we're behind, right? The conversation is not necessarily if you should get it. The conversation is how proactive are you going to be to make sure you get it, right? Because I think it's going to be so easy for us to pigeonhole ourselves into another health disparity by 2-3 years from now. Black people being a community that didn't get vaccinated, as well as other communities. We're still seeing these high death rates, high ICU admissions, high heart disease due to COVID-19 because we did not step up when it was time to get this vaccine and advocate for ourselves to get it. What you're seeing all over this country is that wealthy people are going to poor communities to get the vaccine before poor people are getting it. What is that telling you? That's telling you that it's safe and it's effective. The question is not if it's safe and effective anymore. The question is, are you going to fight in your community to make sure that your family gets that vaccine? Because you at least need this level of protection of what COVID could do. We don't know. 5-10 years from now, we can find out COVID was the worst thing ever and it's doing all these things. And the people that didn't get vaccinated have all these effects. And I think it's more safety in getting the vaccine than the uncertainty and waiting to see what COVID does to our bodies.
Well, thank you so much. That was the word. Please make sure you advocate for yourself. Get what you need. Thank you so much, Dr. Bell.
Thank you so much for inviting me on here. I'm so happy to be a part of your this program. Thank you so much.
Yeah, thank you.
All right, see you
Have
later.
a good night, everyone.
All right, bye.